Welcome to the Smart Providers CEO Breakfast Forum. Let's have a morning of insightful conversations, valuable connections, and most importantly, ideas that can move healthcare forward.
Uganda has the connectivity, the provider network, and now the regional proof that digital transformation delivers efficiency, growth, and sustainability. What we need now is the collective will in this room to accelerate it. Thank you very much for making a difference in the healthcare industry by transforming your processes, by allowing digitization as part of your strategy and as part of your growth agenda.
If you want to benchmark from other industries that are probably much mature in technology than healthcare, the likes of companies that are trying to get into this market, for all these multi-million shareholders, they will not be willing to invest their money first if you don't have technology.
Just because you have authority doesn't mean you have a monopoly on ideas. And that is why, as a head of an organization who is a good businessman and can get a feeling that this is a good idea, it doesn't mean you have a monopoly on good ideas. And that is why you need a framework, a decision framework that can be used by more people in your organization to generate more ideas. And that is something that data can help you do. But if you have come up with a broader decision framework and have an organization where more people appreciate data and they can look at these patterns, they can look at these trends, and they can propose ideas based on the trends that they see, then the organization as a whole can start making better decisions.
Smart Uganda is committed to walking this path with every one of you, not as a vendor, but as a partner in building a healthier and more efficient Uganda. This is a remarkable day and a historical one as well when we launch our PharmaLink.
When you have a solution which is working at your facility very well, you're able to serve your clients very well and they are able to come back.
Align capacity and service investment with where demand is actually occurring, and smart analytics can give you that visibility in the market that you are, in the area that you are as a provider.
One of the things that we have achieved is to make sure that at least we are 90% paperless. In a traditional hospital, you're going to find a patient with around 50 pages if a patient has been in a hospital, and they are all scribbled on by doctors and nurses, and so how do you move from 30 pages before discharge to actually a simple treatment chart or even nothing like we are heading to?
How can we collaborate? We can help you with free optical screenings, sensitization and prevention talks, seamless value added where you can enhance your service offering the patient's experience while we contribute our specialized optical expertise.
Most of our organizations have been consuming technology from the outside world, but then we have now developed the capacity to do our own things based on our real-time setting.
As we empower our healthcare workers to use tools to input the right data, leverage technology and AI, for diagnostics, we must also remember that a machine cannot replace a reassuring hand or a listening ear. If we digitize to the point where a patient feels like a number, then we have failed. Therefore, our call to action is not just to install software, but to be able to use that software to buy back time.